Hi, I'm Steve Rood. I specialize in obstetrics and gynecology, and I am board certified. So I'm originally from northwestern Pennsylvania in a small town called Old City, and I went to college at Colgate University. I went to medical school in Erie, Pennsylvania at LECOM, and then I went to residency in York, Pennsylvania at UPMC Memorial. For the last 8 years, I've been in York, Pennsylvania as a resident and as an attending physician. My wife and I, my wife who's originally from Buffalo, we had our second child, and that was a big drive for us to get closer to family. So when we decided to move back to Buffalo, I was looking for a job, and when I interviewed at General Physicians PC, I had really good experience with everyone. I felt like I'd be well supported here, and I'd be in a good place to really start my career here in Buffalo. In medical school, we do rotation in each specialty. So when I came up on my OBGYN specialty rotation, I really fell in love with the practice. And that first week, I had my first delivery, and it was such a wonderful, good experience. I couldn't stop smiling, that whole month, and I knew that was what I wanted to do for the rest of my career. So osteopathic medicine is equivalent to allopathic or MD. During our training, we emphasize holistic approach to the patient, so mind, body, and spirit. So fundamentally, I approach all my patients in that way holistically as we come up with their diagnosis and treatment. So in my practice, I see a full spectrum of patients, including pregnant women. I care for patients who are experiencing irregular bleeding, pelvic pain. I do cervical cancer screening, breast cancer screening, menopausal patients. So really full spectrum from teenage years up through into the 80s or 90s. My favorite thing about working as an OBGYN is I get to care for women of all ages. Specifically, I really enjoy robotic surgery and minimally invasive surgery. So that's one of the things that excites me and that I can offer to my patients in their treatment. The best advice I can give a patient is to find a doctor that you trust and feel supported by, and be honest with that person, so that the two of you can come up with a good plan for your treatment going forward. Free time, I don't have a whole lot of free time since I have two small children. I have a 2-year-old and a 3-month-old, so most of my time is spent with the kids and the family.